I'm Earl Henchman. I'm a student physical therapist assistant at Carroll Community College. And for our project, we had the trochlear nerve. So I'm going to be going over just some basic functions, where it originates at, and just some type of impairments and things for this nerve. For the nerve, it's only motor, so it doesn't really have much to do with like any sensory information or anything. It innervates, so it innervates the superior oblique muscle, as you can see in this visual right here. I'm not really a good drawer or anything, but it innervates the superior oblique muscle. Now it's what it's really responsible for is just precise, dang, I can't even spell. Precise eye movement, okay? So just like the fine motor eye movements, and as we were talking about like in class, you wouldn't recruit a lot of muscle fibers just for the fine movements of the eye. Now the contraction of the superior oblique muscle, what it does, it inwardly rotates, okay? And it depresses and abducts the eye. So that's just some of the actions of this muscle. So I'll write that down for you. So it depresses, it abducts, and inwardly rotates. Okay. Now this is the only cranial nerve that actually comes from the dorsal aspect of the brain, and it originates in the caudal to the oculomotor nerve, and and the level that it's sitting at is the inferior of the colliculus. I wish I did have a model of a brain to actually show you where it originates at, but we will have like some pictures and everything posted, I guess, along with the video.
Hi, I'm Madison, and I'm just going to be talking to you about the pathology and the testing for the trochlear nerve. So first of all, with pathology and typical injury to this nerve, so injury usually results from trauma, infection, or neurological disease. So I'll write that down for you. So all of these things can impact the trochlear nerve and can do some damage to it, which will affect the eyesight and movement of the eye. Also, from surgical complications, if you have any kind of surgery to the eye or muscles around it, it could potentially impact the trochlear nerve. Okay, so basically, if there is a lesion or some kind of palsy of the trochlear nerve, what you'll see is the opposite eye is affected. So like we talked about in class, opposite sides of the brain and contralaterally to the injury. So the opposite eye will be affected depending on which side. And then, so it will affect the ability of the eye to, like we said earlier, inwardly rotate, abduct, and look down. So you will see certain signs I'll show you when we test it. If the trochlear nerve is damaged, there will be certain things you can look out for in terms of eye movement. Okay, so now let's move on to testing it. Alright, so now we're going to be testing the trochlear nerve. And how you do that is just have the person seated here in a chair, and then you'll take your finger and ask them to follow your finger with their eyes. Typically it's in an H position in the air, so we'll do that now. So just go ahead and look at my finger, and you just follow it in the H pattern. So we're testing the inwardly rotating, we're testing the abduction, and looking downwards. So if there is something wrong with the trochlear nerve, sometimes the patient will have diplopia, which is double vision, and so we'll ask the patient for any signs of that. And also if you see any discrepancies between eyes, like one eye is not moving in sync with the other, it could be something wrong with the trochlear nerve. We would want to look more into that. So that's all there is to it for testing the trochlear nerve. Thanks for watching our video.